afternoon. Thank you all for joining us today, and welcome to our webinar, People Want to Know, How Do I Reduce My Risk of Dementia? First, I'd like to cover some housekeeping items. If you experience any technical difficulties with this event, you can obtain technical support during the session by calling the number on your screen. Today's webinar is being recorded and will be archived on SOFI's Center for Online Resources and Education, CORE, within 2 weeks. To tell you a little bit about SOFI, SOFI is a nonprofit organization whose mission is to provide global leadership to the profession of health education and health promotion and to promote the health of society. I'll now turn the webinar over to Bob Jecklin and our presenters.
Thank you, Ramona. I'll begin by thanking the SOFI staff and all the SOFI membership for making this possible, and a special thanks to Ramona for helping us with the technical side of today's webinar. It's my pleasure to introduce 2 highly qualified speakers who will address the topic today. First, we have Margot Warren. She is the Chief of Health Education and Public Liaison Branch in the Office of Communications and Public Liaison at the National Institute of Neurological Disorders and Stroke, part of the National Institutes of Health. As a project officer for a communications contract with Ogilvy Public Relations Worldwide, she oversees the National Mind Your Risks Mind Your Risks Public Education Campaign. A previous campaign that Ms. Warren led was No Stroke, Know the Signs, Act in Time. Both of these were life-saving efforts and were recipient of the Gold World Medal from the New York Festival Film and Video Awards. Ms. Warren has played an active role in stroke education for the past 20 years, and she serves as a member of the Executive Committee of the Brain Attack Coalition, a group of leaders in the field of stroke. Ms. Warren has worked at the National Institutes of Health for 28 years. She received her degrees in journalism and Latin from the University of Arizona. Our second speaker, Molly French. Molly is the Director of Public Health for the Alzheimer's Association, working closely with the association's national and state partners on the Healthy Brain Initiative. Previously, she consulted with the national nonprofits on population health issues, directed policy research for the Partnership for Prevention, and advanced health policy in California. Molly earned her MS from the University of Texas at Austin and a BA from Drake University. She has been a SOFI member since 2007 and is active in the healthy aging community of practice. Slide, please. Our community of practice believes that this webinar is just one in many steps that the members of SOFI and our friends in the larger community can do to make healthy aging the popular way to live in the United States. Our motto is, healthy aging works, pass it on, and won't you please do that? Slide, please. We have some webinar objectives. Slide, please. And as an introduction, slide, please. As an introduction to our program, I want to emphasize that we realize this webinar is primarily about knowledge and awareness, and we hope that those who view this will seek out other resources with the National Institutes of Health, CDC, the Alzheimer's Association, to develop the skills and further develop the attitudes to really make a difference in this most important public challenge. With that, I introduce our 2 speakers.
Thank you, Bob. Hi, everyone. This is Molly French. And we really are excited to be here today, Margo Warren and I. And as health education and health promotion specialists, you may have been asked, how do I keep from getting Alzheimer's? It's a really, next slide, please. It's really a common concern. In fact, 3 out of 4 adults report that they do worry about developing memory problems when they get older. And their knowledge about, how to keep their brains healthy may come from what they learn on broadcast and print media, but not necessarily doctors or other health professionals. Next slide. Certainly, as we get older, our risk for stroke and cognitive decline increase. But the good news is that there's a growing evidence base that tells us that we can modify, at least at a population level, risk for stroke, cognitive decline, and possibly dementia. Next slide. So I just said the term cognitive decline, and you may be wondering, what really is that? For today's webinar, we're talking about changes in the brain that affect the ability to think or remember. And some cognitive decline is a normal part of aging, but when it starts to keeps getting worse, and particularly when it begins to interfere with daily life, that's an indication that's not normal aging, and it may be an early warning sign for dementia or a number of other potential health problems. When I talk about dementia, don't think necessarily of a disease, but rather dementia is actually a syndrome in which there's impairment in 2 or more areas, such as an inability to remember new information, struggling with complex tasks that used to be able to do previously, even changes in personality. Those are just a few of the potential impairments that are associated with dementia. The graphic with the umbrella shows that Alzheimer's is the most common cause of dementia, and the second most common is vascular dementia, which Margo's going to tell us more about. Next.
Hi, I'm Margo Warren from the National Institutes of Health. And as Molly was talking about, certainly not all dementias are Alzheimer's, and scientists have been able to learn so much more with the new imaging techniques about what is actually going on in the brain to cause vascular dementia, which you saw was number 2, the second most common dementia. And high blood pressure is always the culprit. The strain on the arteries over time of high blood pressure weakens them and ends up cutting off oxygen to the brain. Scientists have done studies of older patients, just a brain scan that shows those with uncontrolled hypertension all their lives show up with brain scans that show white matter disease, which is damage from the wires that connect the brain, and they also show some small silent strokes, which really show up as dark areas, which indicates dead tissue, and those are strokes that people might not even know they're having. They are silent, but all in all, it adds up to a group of what scientists are calling the non-Alzheimer's related dementias, and vascular dementia is number 1. Next slide, please. Molly?
Thanks, Margo. Yep. Recently, the findings of 2 independent panels who did evidence reviews, these findings were published both in 2015. And the foremost being from the Institute of Medicine, which one of their panels looked at cognitive aging, or how our brains change during the aging process. The other evidence review was published in Alzheimer's and Dementia Journal, with a focus on the evidence for risk factors for cognitive decline and dementia. And although these 2 reviews had different areas of focus, both reached nearly identical conclusions about protective and risk factors for cognitive decline. And one of the areas of consensus was midlife hypertension, so just as Margo alluded to. Next, please. Beyond midlife hypertension, the panel's evidence reviews also identified physical activity, quitting smoking as ways that factors that can be protective, and certainly other risk factors that relate to your overall heart health. So beyond hypertension to include diabetes and midlife obesity. And all of us have heard in the news in recent years, too, just about the impact of traumatic brain injury and how harmful that is for our brains. So there's now a good, solid consensus about kind of, at least at this point, this cluster of protective and risk factors. And so you can think about it really as what's bad for the body is going to be bad for the brain, but also what's good for the body is also going to be helping keep your brain strong and healthy. Next, please.
So we've come to the thought that managing all these risk factors that you've probably been talking about for years to your audiences can also protect them not only from stroke and heart disease, but possibly dementia, the vascular dementia that is number one cause, high blood pressure. Dr. Korchetz, the director of our institute, likes to say that high blood pressure is not only the number one cause of stroke and heart attack, it is also the number 2 and the number 3 cause. And if you look at the numbers, you can see that 80 million people in this country have high blood pressure, and only 40 million, half of them, that's a lot of people, do not have it under control. And controlling hypertension, we know, can prevent stroke. A 10-point reduction in systolic blood pressure can result in a 1/3 reduction in stroke risk. And as 30% of stroke survivors develop post-stroke dementia as a result of what I was talking about with the various damage to the brain from a lack of oxygen. But the good news, if there is that it's preventable. And the risk factors you've seen on other slides, they're always the same. The blood pressure, smoking, cholesterol, managing your diabetes, and eating healthy and staying active. So NIH doesn't do much of anything without a whole lot of research behind it. And when our director asked us to put together this campaign, he asked the staff to do a very broad literature search of all the research that shows about this connection. And our staff found a great deal of material. And I just want to mention a couple of our bigger studies. This one is called ARIC. It's Atherosclerosis Risk in Communities, and there were 15,000 participants. They were followed in 4 states for 20 years, and that study showed exactly what we're talking about, that high blood pressure during middle age can lead to an increased risk of cognitive decline at later ages. There are also some studies across the world that are showing a slight reduction in the rate of dementia. Some of our vascular neurologists think that this may be no coincidence that the stroke rates have also fallen during that period. That in recent years, stroke used to be the number 3 leading cause of death, and now it is number 5. So another big study that we have that we're very proud of at our institute is called REGARDS. And this one has 30,000 participants. And it's just a look at why there's such a disparity. I think you've probably heard about the stroke belt in the southeastern states. There's a great deal more stroke there. There's a disparity between the numbers of blacks and whites who develop stroke. Often blacks develop strokes that they just earlier in life and often more severe. So this study showed one of the things that if people have high blood pressure and they're controlling it with medication, they still have a higher risk for stroke than patients with normal blood pressure. So the idea here is it's just best not to have high blood pressure in the first place, and taking action early in middle age to control it is the best.
So here at the Alzheimer's Association, we're really grateful to all that NIH does for its leadership on all aspects of aging and health, and particularly, of course, on Alzheimer's and other dementias. Since 2005, our association has also had a strong partnership with the Centers for Disease Control and Prevention on the Healthy Brain Initiative. And the Healthy Brain Initiative calls for public health approaches to help stem the rapidly growing burden of Alzheimer's and other dementias. So together with CDC and many other public health partners, including SOFI, the Healthy Brain Initiative has produced a set of roadmaps that outline specific ways national, state, local public health communities and professionals can protect brain health, improve the health, safety, and quality of life for people living with the disease, and help address the needs of caregivers. This slide shows you a picture of the current roadmap, and one of the recommended actions in it is to disseminate evidence-based messaging about brain health and cognitive decline. And there's, next slide, and there really is a clear need for health education specialists, health promotion specialists to act, as shown by some new data from the Behavioral Risk Factor Surveillance System. Next, please. So in 2015, 35 states in their annual State Health Survey, or BRFSS, added questions to the core set of questions about increased confusion or memory loss, or what we're calling subjective cognitive decline. And then if people were reporting subjective cognitive decline, what kind of impact was that having on their lives? So as you can see, in 2015, about 1 out of every 8, or 12% of adults aged 45 and better, reported subjective cognitive decline. And subjective cognitive decline is one of the best predictors of future Alzheimer's and other dementias. The data also show that among older adults, mid and older adults who are reporting subjective cognitive decline, quite a few of them, about half, describe their overall health as fair or poor. And over about a third say because of these increasing memory and problems with thinking that they actually need some type of assistance. And even though these subjective cognitive decline is, can and these data show is interfering with daily life, we know that not enough people are talking about memory and challenges with thinking with their healthcare professionals. So less than half are actually having these types of conversations. So these data here are just some of the reasons why we're just so pleased that NIH has started the new campaign on Mind Your Risk. Margot?
Thank you. And so on Groundhog's Day, February 2nd of this year, we launched the Mind Your Risks campaign. It's a new public education campaign, and we like to think of it as the bottom line, if you could advance the slide, please, is that treating high blood pressure and keeping it under control is good for the brain, and it's also critical to act early. Now, I've said middle age several times here, but you'll be glad to know, I know I was, that middle age is defined as 45 to 65. So there's plenty of time. Let's go to the next slide. When we developed the campaign, we did some focus groups that were very illuminating. We went to 3 cities, and we had people in the groups who were exactly our target audience between the ages of 45 and 65 who had hypertension and weren't particularly 100% controlling it. And we got a lot of information about them on what the risk of not controlling their blood pressure was, and they certainly knew that they were at risk for stroke and they were at risk for heart attack. But when we said, do you know it's also linked to dementia, people were very surprised, and they started to think about their relative, this or that uncle who'd had hypertension and did have some problems as he got older with cognitive decline. and they wanted a lot of information about this. They hadn't talked to their doctors, they hadn't heard it from their doctors, they hadn't seen any campaign about it, really. So we knew it was time for this Mind Your Risks campaign. And the other thing that the focus group members told us is that people really need to be almost afraid, that they need to know that this is a huge risk, not controlling your hypertension. Next slide, please. So what could be riskier than swimming with sharks? That's sort of our linchpin image, and we've used this image to roll out to people that the cut line says dementia and stroke are more likely to affect people with high blood pressure. Don't take unnecessary risks. Keep your blood pressure under control. Learn more at mindyourrisks.nih.gov. And the campaign points, as you'll see on the slide, we want to raise awareness among middle-aged people with hypertension that controlling blood pressure may decrease their risk for dementia as well as stroke. And we want to provide information to doctors, all of that scientific evidence I talked about earlier, for those who are ready to talk about it to their patient or whose patients come in and ask. And we also made sure that we have a lot of partners so that we can promote the very good blood pressure management tools that already exist. NIH focuses more on the research side, but we know so many people have wonderful tools. And a word about partnerships, our prime partner is the Million Hearts Initiative, which was set up a few years ago with the goal of preventing 1 million heart attacks and strokes by 2017. And we've also partnered with our fellow NIH institutes, the National Heart, Lung, and Blood Institute, the National Institute on Aging, and we've also had other federal partners that have led to so many connections, the CDC, the ACL, and Black Nurses Rock came as a link from the Coverdell seminar, and the Alzheimer's Association. I want to thank them. This is the beginning of a great partnership with NIH and the Alzheimer's Association. So this slide shows another high-risk behavior, and this poster was shown in magazines. We rolled the campaign out in the stroke belt, so we put posters, print ads in the March issues of several magazines, which we feel are read by our target audience: Health Magazine, Every Day with Rachel Ray, Cooking Light, Shape, and Food Network Magazine. And we also put our posters in malls because the visibility for campaign messages is very good in malls, and people, we hope, stopped at least to look at the shark or look at the cliff diver. And they were in 8 states in the stroke belt. And in case you aren't familiar with those states, it's Virginia, North Carolina, Tennessee, Kentucky, Georgia, and Louisiana. And we were also in South Carolina, Mississippi, and Alabama. We reached 3 million people with the magazine ads, and we estimate that the PSAs in malls were seen 17 million times. So this, our website, I hope you'll take a look at it if you haven't already. It's mindyourrisks.nih.gov. And we tried to put something for everyone in that website. We've got material for patients who want to understand how to manage their risks. We've got very good explanations of what goes on in the brain when you have hypertension all your life. And we have a lot of partnership material, resources for Million Hearts, and so on. And we also have a whole section for healthcare professionals, because we hope if we do our job right, they'll be getting more people in who are saying, what about this link to dementia and what's going on with hypertension? And so they have all the scientific evidence that they need, certainly, with this website. So just to give you an example of the mall displays, this is the shark, and these are all malls in the stroke belt area. And next, we have a picture of the ad that appeared in all of the healthy lifestyle magazines. And next, we have a good old-fashioned brochure, a print product. Please feel free to order it. We still know that many people like to have something in their hand, and so we've made many copies of the brochure. They're available free of charge through our clearinghouse. You can get one, or you can get a number of them for an event you're having. And then, of course, social media, too. The cards on the right show that we have graphics that are shareable either for Facebook or Twitter. Next. So our campaign has created a lot of social media buzz, and we know it's hard to measure buzz, but we know that it's out there. And we've had a lot of help through Twitter chats. We have had the good fortune of pairing up with Dr. Sanjay Gupta from CNN, and he just has millions of people who follow his chat. So we were able to do a chat with him during May Stroke Month that reached so many people. And Dr. Koroshetz has been going on the air. He did a big radio media tour. He also will go out and he speaks about this. He's a very big public speaker, and he always mentions mind your risks. That's a particular passion of his. And CDC, there are all of the logos of our partners. So Molly.
Thanks, Margot. And I just love the Mind Your Risks campaign, although I think the guy jumping off the cliff should have a helmet on. So we wanted to tell you about some other great free resources that are available for your work if you're working in hypertension or you're part of the Million Hearts campaign or out in the community helping people understand what and helping them actually adopt new behaviors to stay healthy. So another great resource for your work is from the Administration for Community Living, and particularly from when it's part of ACL, which is Administration on Aging. So ACL worked with both CDC and NIH to develop these brain health resources. And they're a set of free kits that anyone can download and access and then use to educate the public about ways to protect their brain. They include one just on overall brain health and cognitive aging, and that has been translated into Spanish. So we encourage you to access that, and we will, at the end of the webinar, provide the URLs and other ways to access Mind Your Risks and these other ones I'll be telling you about. The ACL Brain Health Resources, there's also one on medication safety, which we know is an important health issue, particularly for older adults, and also one on brain injury. And health professionals can use these brain health resource kits either just to do health education workshops in the community, or you might know of organizations, have your partners be doing these type of educational events or getting information out to their members or their partners. So, make sure that let senior centers, libraries, communities of faith know that these brain health resources are available free from ACL. And you can also just look at the toolkits and start integrating some of the messages from them into whatever campaigns or interventions you're doing. Next, please. Here at the Alzheimer's Association, we are not just about serving people with Alzheimer's and other dementias and their caregivers and the many ways that Alzheimer's can affect people and their communities, but we're also actively promoting risk reduction. So on our website, we have information about what are the risks for Alzheimer's and other dementias and cognitive decline. And particularly in June, you may see our 10 Ways to Love Your Brain campaigns going on. And across the U.S., our chapters are available to come in and conduct workshops with our Healthy Living for Your Brain and Body curriculum. Next, please. We've also have heard from a lot of public health professionals in recent years that they are seeing an increasing need for educating the public. Alzheimer's is getting out. It's in the news, even in local media markets, national media markets, several times a week. And it's certainly, as we saw earlier, responding to a really common worry people have. So while a lot of public health agencies don't necessarily have money for a brain health campaign, they do see an opportunity and a lot of benefits to bringing in ready-to-use messages into their existing public health campaigns. So to respond to this, we here at the Alzheimer's Association, we work with CDC, an ad hoc group of state public health senior leaders and other experts to develop some messages in these 6 areas where the evidence is the strongest about the correlation between some of these health behaviors and also cognitive decline, possibly dementia. So physical activity, quitting smoking, preventing, controlling your hypertension, diabetes, trying to stay at a healthy weight, and certainly using helmets and protecting your head from injury. So, for example, one of the messages is it's never too late to start exercising for your brain and your body. So we're really trying to emphasize this brain-body connection. Next, please. And to give you a more tangible example, here's a mock-up of a potential quit line ad that could be in print or on a billboard, about the benefits of quitting smoking. And so these are the types of things where you might want to just work in occasional messages, help freshen up your campaign, talking about that quit smoking for a healthier brain and body, or the fact that it's never too late to quit smoking. And quitting at any age seems to benefit the health of your brain and your body. Next, please. And we're back to Margot.
Thank you, Molly. So as health educators, next slide, I'm sure you remember real toolkits, which I always loved producing with a little handle and a little briefcase you could keep forever. But now everything is a virtual toolkit, and that's what you'll find on our website under the Resources tab. So go to mindyourrisks.nih.gov, and you can download, just like what Molly has, downloadable, everything except that brochure I told you about, which we will send out in print form. And we are continuing to work with other organizations. Thank you so much for this opportunity today. This is just what we have in mind. Thanks to the SOFI audience for listening and getting to know about our campaign. We can help your various organizations and groups by sending you a blog about the campaign. We can develop newsletter articles. We can write editorials, and we're happy to do that if you just contact us. We can also, to some degree, send staff around to make speeches and presentations. I'm going to be going to the Black Nurses Rock Convention in Chattanooga in October, and we always are open to more partnerships. We want to allow you to co-brand our materials. We're making brochures and posters that have room for a second brand so that it can be localized. And I just appreciate the time we've had today to tell you about the campaign.
Thanks, Margot, for being willing to join us. So I just wanted to, getting close to wrapping up, but, remind you that there's a lot of great evidence-based messaging from NIH, of course, ACL, CDC, and our association, so that you can really have a running start to help the public understand what they can be doing to protect their memory and thinking in the years to come. We encourage you to just download, explore these materials in your own health promotion initiatives, and make sure that your partners, whether it's hospitals, clinics, community-based organizations, organizations that are offering evidence-based programs like My Chronic Disease or the Diabetes Prevention Program, make sure that they know about Mind Your Risks and the ACL Brain Health as you age resources to educate people about what's good for the body is also good for the brain. Next, please. We're excited that there's already kind of relatively a short time the integration of brain health messages in a variety of different formats and channels. So the California Health Department developed educational flyers for the public and put them on their website. New Mexico's Health Department, even just this month in September, they were encouraging public health professionals at the state and local level and all other state employees to use ACL brain health resources and in terms of helping people understand what they can do to enjoy long, healthy lives. And not last but not least, both Utah and Vermont have integrated messages about brain health into their Quitline campaigns, trying to reach particularly those older lifelong smokers. So, Margo and I really appreciate your time you took to join us on this webinar, and we especially thank Sophie and the Healthy Aging Community Practice for providing us with this opportunity.
And I can just add that we do have a clearinghouse full of materials on all sorts of neurological disorders and stroke, and now Mind Your Risks. But please feel free. They're they're there every day, every week, and they can send you materials or answer your questions. Thanks again.
On behalf of the community of practice, thanks to both our speakers and thanks to all of you who have taken the time to tune in and learn more about a wide array of options for developing programs to maintain brain health. Thank you so much.